Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. In this week's quick video, I want to discuss ear infections, aka Otitis Media in children. So we know, most people know, eustachian tubes can get blocked because a baby may have a fever and fight in a little something. That can cause fluid to back up in the inner ear, and then that can become either a viral or bacterial infection. And we want to keep in mind that bacterial infections may need to be treated with an antibiotic. Viral infection doesn't need to worry about it. It can be cleared out on its own. It's kind of a wait and see approach. Now, we don't want to wait too long. We don't want to be ignorant about this, but we want to do it in an educated manner. So talking about it chiropractically, sometimes, the birthing process is not the easiest process to go through. So there can be some issues in the cervical spine where things get locked up and not moving. You may notice if a child is trying to turn their head to the left or right, where they can go real far one way and then they don't go very far the other way. And it should be even distribution left and right. And we want to make sure that we are aware and pay attention to those things. If you're noticing things like that, chiropractic could be of great use and great service to the child and to the whole family. Because chronic ear infections can lead to hearing loss, and we can also have speech development issues. So, my children, I have 3 girls, ages 12, 11, 11. I have twins. And, with all 3 of them, my kids have never had an ear infection when they were little growing up. And we started treating them when they were born. And the awesome thing about children is they respond so quickly to care. If you get them adjusted 2 or 3 times, you may notice that's starting to change already. Sometimes with older people where they have chronic issues, they've had multiple whiplash accidents, they have things going on, it can take a few weeks to really see that major effect in feeling better. But when it comes to ear infections, remember with an antibiotic doesn't know the difference between bacteria in the ear or bacteria in the gut. So though they can be life-saving, we don't want to overuse it and create antibiotic-resistant bacteria. Now, when something goes on and they really need it, the bacteria might be too strong for the antibiotic. So just like with a muscle relaxer, if you take a muscle relaxer, the relaxer doesn't know if it's a heart muscle or a skeletal muscle. It has this effect on the whole body. An antibiotic doesn't know the difference between gut bacteria, which we have to have. That's why sometimes kids that take it and they're getting diarrhea, and they can have other issues. So, think chiropractic when it comes to ear infection. Get a couple of adjustments. If it helps, fantastic, okay? And just, is it viral or is it bacterial? Try to get a swab, find out what it is, so you're not giving antibiotics in an unneeded situation. All right, I hope that's helpful. Have a great week.